Did you know there's an artery running just 1 centimeter from your sternum that surgeons often use in heart bypass surgery? Let's master the internal thoracic artery in just a few minutes. The internal thoracic arteries are paired arteries right and left located deep to the anterior chest wall. Each one runs on either side of the sternum. Let's start with the origin. The internal thoracic artery arises from the first part of the subclavian artery. Tip: think subclavian gives internal thoracic early in its course. Now the course this is important. The artery descends downward, behind the medial end of the clavicle and upper 6 costal cartilages, about 1 centimeter lateral to the sternum. It ends in the 6th intercostal space. Here, it divides into 2 terminal branches: superior epigastric artery, musculophrenic artery. Now the branches vary. Exam important. 1. Pericardiophrenec artery. O travels with the phrenic nerve. O supplies pericardium and pleura. 2. Mediastinal branches. O small, variable. O supply thymus, connective tissue, and pericardium. 3. Anterior intercostal arteries. O2 in each of the first 6 intercostal spaces. 4. Now let's continue with the remaining important branches of the internal thoracic artery. These are very high yield for exams. Perforating branches. These branches accompany the anterior cutaneous branches of intercostal nerves. Important clinical point. In females, the perforating branches from the 2nd, 3rd, and 4th intercostal spaces are quite large. Why? Because they supply the breast. This is a favorite exam question, especially in anatomy and surgery. Next, the superior epigastric artery, one of the terminal branches. It runs downward behind the 7th costal cartilage, passes between the sternal and 1st costal slips of the diaphragm, enters the rectus sheath. Inside the rectus sheath, it anastomoses with the inferior epigastric artery. Function: supplies the interior abdominal wall, from the clavicle down to the umbilicus. Now the musculophrenic artery, the other terminal branch. It runs downward and laterally, passes behind the 7th, 8th, and 9th costal cartilages. It gives 2 anterior intercostal arteries to each of the 7th, 8th, and 9th intercostal spaces. Then pierces the diaphragm near the 9th costal cartilage, reaches its undersurface, supplies diaphragm, muscles of the anterior abdominal wall. Let's wrap everything up quickly. Origin gives subclavian artery. Course gives descends near sternum. Ends gives 6th intercostal space. Perforating branches gives breast supplies 2nd, 4th spaces. Superior epigastric gives anterior abdominal wall. Musculophrenic gives diaphragm plus intercostal spaces. Clinically, this artery is often used in CABG due to its durability and location. If you made it this far, you're serious about mastering anatomy. Hit like, comment your doubts, subscribe for more simplified medical lectures, and don't forget revision is the key to retention.